Dr. Jen back with us again now to answer a health issue on your mind. Here's the question. What can you do to prevent nausea from certain prescription medications? That one's from Candace H.
Good one.
Well, obviously, what makes this so hard is that you theoretically need that other prescription medication, which oftentimes can come with a side effect of GI distress or nausea. Chemotherapy is obviously the most popular or famous one that does this, but there's a long list of medications that can contribute to nausea, and you don't want to just discontinue that medication for the good that it's doing. So the idea is, what can you do to deal with the nausea? First and foremost, there are prescription anti-nausea medications that can be really, really helpful. There are non-prescription things like ginger or peppermint tea. Chewing gum, believe it or not, also works to relieve nausea because it keeps the GI tract moving forward without putting food in there. Asking the pharmacist or the prescribing healthcare provider about timing, whether or not you should eat or eat before you take the medication or take it on a full stomach. Obviously, that can help. And then distraction, if possible, just getting outside, doing something that takes your mind off that horrible nausea feeling can get you over that if it's temporary.
All right, your prescription for wellness.
All right, you guys. Well, you know, telemedicine came about really into its heyday in the pandemic, but it is here to stay. It can be really helpful and convenient for both the provider as well as the patient, but there are some tips to prepare. So knowing what medications you're on and the doses, even if you have to have those pill vials in front of you, is really important. Writing down any symptoms, questions, or concerns that you have before that visit to take notes during the visit is important. And then do a quick vital signs check before that encounter. So check your temperature, your weight, if possible, your heart rate and your blood pressure is good. And then just keeping some way to take notes during that telemedicine encounter is really, really important if the provider won't provide them for you afterwards. A lot do and will say, I'll email you, but you should also be jotting down some things.
And folks, we would love to hear from you. So hit us up on Instagram with all of your medical questions for Dr. Jen at ABC GMA3.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.